Sacred Heart Medical Center at Riverbend in Springfield, Oregon is a 1.2 million square foot state-of-the-art facility and part of the PeaceHealth network. Listen to how Versus Advantages has helped this facility promote patient care, productivity, and business intelligence for the organization. How does Versus Advantages enhance patient care?
Anyone who's ever worked in an emergency room, in an operating room, in a busy hospital department knows that there are an incredible number of phone calls that you have to answer, and they're usually always focused on where's the patient, what's happening with the patient, what's the status of the patient.
When PeaceHealth first built their new hospital, they wanted this healing environment created. Versus complements that. The minute the patient walks in the door, they're given a badge. Significance of that is now the patient feels that they're part of the system, they're recognized. I've been in a medical facility where I was put in a room and nothing happened. I actually got up from the chair I was in and stuck my head out to say, did somebody forget me? With Versus, you don't have that problem.
So the patient then is sensed in radiology, it's sensed in nuclear medicine, they're sensed in x-ray. No matter where the patient goes in our setting, that patient is tracked, and the information that's associated, the physicians, the nurses that have been assigned to that patient, the labs, the x-rays that have all been ordered, all that information stays displayed on our monitors. They manage their patients right off those boards.
Now, we have hospitals in Eugene and Springfield, and they're sister cities. If a person has a situation where they need to go to the ED, they can actually go on the website and look to see what the wait times are in both EDs. And it gives them the choice to go to one if there seems to be less of a wait time. Now, this takes a tremendous amount of stress off the person.
How does Versus Advantages enable greater efficiency?
Another tool I can offer management, looking at data, is the ability to increase productivity. They can look at current throughputs, compare that against national average, and then think, okay, if we did this, we might be able to improve. We've actually done that using Versus data. We have increased our throughput from waiting times to physicians seeing patients. We've cut little corners, and 5 minutes, 10 minutes here makes the difference overall. And they can make those kind of fine-tune adjustments by looking at the data that's provided by Versus.
It has allowed us to cut down on the time that it takes for us to tell a physician that a patient is ready to be seen. It has allowed us to cut down on the time that it would take for us to know that there are orders that the physician has written that need to be put into the electronic medical record. It's also allowed us to know when a patient is ready to go home and just needs their last treatment. It's all about saving steps and saving time. And I have to say that overwhelmingly, the Versus system has allowed our emergency room to realize an incredible amount of fewer steps and still communicate with one another in a seamless and passive way. It has added so much to the ability to communicate amongst one another seamlessly without having to actually even really say much to one another. And because of the Versus system, it has allowed us to cut down on our telephone calls 50 to 70% sometimes. We have a nice, quiet emergency room.
Versus is multidimensional. You have the front end that shows all the real-time displays, so staff can work with that. Staff knows what needs to happen next.
And that's huge in the life of a nurse and a physician.
How does Versus Advantages promote business intelligence?
Versus is real time. As it happens, it's recorded. I like to think of Versus as the GPS of the ED. They know when labs are coming back. They know when x-rays are coming back. They can know the next turn, if you would, in the patient's care. But while that's occurring, behind the scenes, there's a tremendous amount of data that's being recorded. It's the ability to capture that information and to be able to recreate any given day, any given month for trending, for drill down information. And to me, management needs that to improve process flow. So they can slice, they can dice, they can ask for information to be brought down to a certain level. That just seems invaluable. It's not perceived notions, it's hardcore information.
If I have done anything in my career as a trauma and ED nurse, it has been to put in the hands of my peers and colleagues a system that allows them to not to forget and to keep their mission close to their hearts and their hands, because it's all about the patient.
Strengthen your organization with greater efficiency, enhanced patient care, real-time business intelligence, and more with Versus Advantages. Go to versustech.com to learn more.